But it's my absolute pleasure to introduce Dr. Kim DaeKeun. Dave, I think I'm going to call you Dave. That's okay.
That's okay.
Who's director of the Corporate Research Institute at Medisync Inc. He's also the principal investigator for the AI data collection and machine learning model for cognitive disorders. Dr. Kim is the project leader at MediSync for the development of the 19-channel dry EEG and photobiomodulation headsets, iSync Wave, which I had the absolute pleasure to see the demo. It was quite amazing. The headset was developed in 2021 and recently has received FDA approval, so congratulations. Dr. Kim was the senior researcher at iMedisync for development of the AI automated analysis platform, iSync Brain for QEEG-guided digital mental health. He is also the principal investigator for the development of autonomic QEEG analysis for early prediction and diagnosis of cognitive dysfunction and dementia using artificial intelligence and machine learning. Quite impressive. This work is in conjunction with the Ministry of Science in ICT South Korea. Dr. Kim was the senior researcher in developing the world's first sex and age classified normative QEEG database at Seoul National University. Dr. Kim has also developed an electrophysiological biomarker of self-healing. He had started with electrical engineering and got PhD in emotion engineering. So it's utmost pleasure to introduce Dave. Thank you very much.
Yes, shall I start?
Sure, yes.
Yes, okay. I'd like to share my screen here. Okay. It is great honor to have an opportunity to present here in an ANSA annual meeting. Thank you. Thanks, Mozana, so much for inviting me. I'm DaeKeun Kim, a director of Corporate Research Institute and iSync Wave project leader in iMedisync. My background is biosignal analysis in electrical engineering, PhD in emotional engineering. I was involved in first ever sex classified EEG database development project since 2012 to 2019. I have also involved in development of AI iSync brain analysis platform with the database. Recently, we developed an innovative dry EEG headset and now integrated with iSync brain platform. Today, I'd like to introduce how we can take advantage of AI-guided EEG HRV automated analysis with AMICA window for understanding patient symptoms and how we design personalized neuromodulation protocol. This banner shows our brand new iSync Wave device, FDA cleared 19-channel dry EEG device. Also has a neuromodulation function using infrared LED and was selected as a Red Dot Design Award winner this year in medical device area. The catchphrase is just 10 minutes, overcome mental pandemic with AI brain mapping and LED therapy. We can usually measure 5-minute EEG HRV, and then we can give them another 5-minute personalized neuromodulation, not just in clinical environment, but also in home setting. I will show you a demo recording and photobiomodulation session in the presentation. Now we are in the times of stress and trauma, but technology is not so much integrated in the mental health area. But iMedisync developed AI-guided brain mapping solution, iSync Wave and iSync Brain, as an objective measure of human brain and implemented personalized intervention solution at the same time. I think we can help many people together with this quiz-guided, personalized technology, conjunction with many established practice in this time of stress and trauma. The amazing woman, Vanessa O'Brien, British-American explorer who climbed Mount Everest and dived deepest ocean in the world, and also succeeded her space mission with Blue Origin last August. She has the first ever completed explorer's trifecta. The photo showed that she recorded her EEG by herself just before the space mission. Now she wants to explore our field together, and now accepted as Global Honorary Ambassador of eye medicine. Last September, 2 weeks ago, there was a seminar titled Post QEEG Guided RTMS and TDCS Research and Oxford University. They intensively used RTMS in autism and developmental disorder, and they has a lot of success in autism, as you know, very difficult area. Originally, RTMS is very well established neuromodulation for the refractory depression area, but there are still non-responder for the depression area. So now they want to use our technology to develop personalized neuromodulation protocol using iSync wave quick recording and AI-guided analysis. They also want to develop Age Biomarker of RTMS non-responder for the depression using our technology. That's why they invited me in the seminar. And Dr. Antonio Martin Maura, I'd like to, here's Dr. Antonio Martin Maura, also present his clinical cases using iSync technology at the seminar. Best Biofeedback Federation in Europe and Montesilvano, Italy, many folks there also experienced iSync wave quick quality dry recording and seamless AI, EEG, and HRV analysis right after the recording, usually 10 minutes. Many folks there really enjoyed iSync technology together. The first part of the presentation, I will briefly introduce corporate, our company and product, and I will give you a product demo, and I'd like to show some case series. iMedicine is a AI-driven mental health care platform company offering early detection and treatment of dementia and other mental health disorders. We have around 60 employees and 4 KFDA and 1 FDA solution. iSync Wave innovative dry headset as a KFDA and FDA medical device, and now on the CE review. iSync Brain C automated EEG analysis solution as a KFDA software medical device, and now on the FDA review. iSync Brain M early detection, early screening biomarker for the AMCI as a KFDA software medical device. iSync Heart automatic HRV analysis as a KFDA software medical device. The major product is iSync Wave, EEG and personalized PBM device, and cloud-based AI, EEG and HRV analytics, iSync Brain and called iSync Brain and iSync Heart respectively, and AI CNS biomarker such as MCI classifier, depression prediction biomarker, and brain age biomarker. This slide shows a history of iMedicine. iMedicine was established in 2012 as a spin-off company from startup company from the National Standard Reference Data Center for Korean EEG at Seoul National University, funded by government. In the data center era, we developed first ever sex classified database in the world. We collected 1,800 normal population between 2012 and 2019, finally selected 1,300 healthy normal population from age 4 to 82 to build the database. It took 8 years, very long time, because each participant had to go through 2-hour long normalcy test comprised of neurocognitive assessment, emotional assessment, and behavioral assessment. We have developed AI-based automated analysis engine, iThinkBrain, and also developed an MCI, early detection Age Biomarker. And finally, we developed the innovative EEG HRV measuring dry headset and integrated with AI automatic analysis to make a platform services from measuring to personalized brain solution. I think Wave is not just assessment device, but also give photobiomodulation and neurofeedback and telemedicine interface as a treatment device. Recently, we developed the brain age biomarker for child and adolescent, developmental monitoring, and depression early detection, depression prediction biomarker. We'll add EEG HRV-based disease biomarker one by one on the platform service. Our corporate identity is AI brain scanning and enhancing platform service. We can give early screening biomarker for solving global dementia problem, and also gives an objective tool for brain monitoring for precision psychiatry, where we can select right medication based on the patient EEG data in the precision psychiatry. We also give the personalized neuromodulation and combined neurofeedback protocol on iThinkWave device. Now we are about to integrate brain age biomarker for child and adolescent developmental monitoring and depression early prediction biomarker. Here is a healthcare trend given by CV Insight. There are 7 core trends. We now adopt most of cutting edge trend. We have AI analytics and platform services for the telehealth, telemental health. We have a measuring and digital therapeutic device in the platform as a mental health tech. We are combining all healthcare trend except omics as a healthcare IT service. But recently we included microbiomes with collaborating partners. Because brain gut axis very important for the tackling the neuroinflammation in the brain. So now we are start to integrate microbiome. Our digital therapeutics is a personalized LED therapy and neurofeedback on the iThinkWave device. And we have a plan to combine TDCS in the same device in next few years. There is a clear rising trend of the digital therapeutics industry. We can take advantage of this opportunity together using QEEG-guided personalized digital therapeutic solution. iThinkWave dry EEG measurement simplify EEG measurement process and give us quick quality recording. International 1020 standard positioning of the electrodes are secured during an expansion of the headset, and the data is uploaded automatically after recording. iSyncWave adopts the special designed analog front-end in the EEG amplifier and use silver chloride coating on tips of the brush-type conductive polymer electrode. And we have a special gear and spring structure to maintain suitable contact forces in each electrode while fitting various head shape. The headset is a multifunctional device which also measures HRV during EEG recording and give the neurofeedback and photobiomodulation using the same device. You can seamlessly integrate neurofeedback and photobiomodulation in the same device and easily measure pre and post intervention EEG data, which makes monitoring efficient. The remote therapist can monitor their client EEG recording at home using the portal site and can supervise or design neurotherapy protocol remotely. And after iSyncWave recording, iSyncBrain analysis gives a standardized AI denoising and standardized EEG HRV analysis pipeline with sex-classified normative database. And finally, a clinician-friendly quick summary report, usually in 10 minutes. Using the quick EEG summary report, clinician can find the underactive or overactive area in the source level and select the medication based on the activity pattern, and also design the neuromodulation intervention targeting those areas using especially the component location, source location information of abnormal component. And MCI quick summary report can detect MCI probability to prevent the dementia more earlier. And HRV summary report gives us automatic assessment and stress profile based on the general adaptive syndrome model and emotional issues based on machine learning model. Recently developed the depression prediction and brain age will be integrated on the service soon. We'd like to give a mental health solution which connect home-based client and remote therapists, especially in this pandemic area. Once EEG recorded using iSync platform, the data can be reviewed by QEEG expert anywhere in the world through the cloud. So using this kind of platform interface, we can give the QEEG guided personalized solution and basically combining the abnormal ICA component information and normative comparison with the QEEG hypothesis. We can give the QEEG guided personalized solution, and we can integrate neuromodulation and neurofeedback. Now, but neurofeedback is still under developing. So after finish the developing neurofeedback function, we can integrate neuromodulation and neurofeedback in the same device and seamless integrated. And using the telemedicine interface, the patient cannot visit every time in the clinic. So we can rent a device in the home-based client, and we can connect them through the telemedicine interface using the iSyncBrain portal site. We can supervise patient training remotely. iSyncBrain platform give us the mainstream. We'd like to accelerate QEEG adoption in mainstream clinical practice. That's why we make many kind of quick summary report for the AMCI. Now we are building a service for the developmental age monitoring for pediatric neurologists, and we will integrate the depression prediction soon for the psychiatric practice. And we give the neurofeedback and photobiomodulation, especially photobiomodulation is very special for the treatment of the neuroinflammatory disease and many kinds of developmental disorder coming from the neuroinflammation, coming from bad dietary habit of the developmental children, makes the brain toxic environment in their brain, and you can use the photobiomodulation to handling the neuroinflammation in their brain, because photobiomodulation can stimulate mitochondria and also microglia. Microglia is the main player of the brain immune function. So activation of microglia, we can give many beneficial effects. Neuroinflammation, for example, stroke and the TBI, and many kinds of degenerative disease, neuroinflammatory disease such as Alzheimer's disease, Parkinson's disease. The photobiomodulation is especially promising in terms of neuromodulation disease. In the area of neuromodulation disease, neuroinflammation disease. I will explain in later. In this part of the second part, I'd like to briefly overview our product. Our main technology is to addressing the unmet need in the mental health care area. The first core technology is the innovative EEG device, EEG 19-channel EEG device, and second one is the automatic EEG denoising. It can, in many clinical situation, it is usually very time consuming. In many mainstream medical doctor cannot adopt this kind of time consuming AI denoising, so we develop a manual denoising. So we develop this kind of automatic denoising. And we have the strong normative EEG database, world first sex classified database, and we develop many kind of EEG AI biomarker using our standard AI biomarker developing process. This is our platform services, the measurement, and then AI analysis, the 90-channel EEG analysis and HRV analysis after the EEG and HRV recording. And we can give many kind of CNS biomarker analysis, and also gives you the photobiomodulation therapy, and also neurofeedback therapy once we develop it. And I'd like to briefly show the example iSync platform, iSync product use case as a QEEG guided mental health. We can tackle the MCI issue using the MCI classifier. We can start the early prediction with the photobiomodulation, and TDCS is another good neuromodulation, but it is not implemented yet in our device. But we are developing this TDCS too, so we can design the photobiomodulation and TDCS protocol once we find the MCI probable population using this the MCI classifier, and finally we can give them a neural regulation training protocol. Finally, eventually transform their brain into more healthier zone. This is neurofeedback. For the depression issue, we can use the depression prediction biomarker, and conventionally RTMS is very well established in the refractory depression area, but still there are non-responder. We can make the non-responder biomarker for RTMS together with the Oxford group. And TDCS is also a very good neuromodulation method for the depression, and photobiomodulation also very good for the depression. And we can take advantage of this neuromodulation and combine the neurofeedback. And developmental issue, we can use the brain age prediction biomarker for child and adolescent, and we can design the photobiomodulation or TDCS or RTMS. RTMS is also in another area of depression. RTMS is a starting phase. Actually, PBM is also starting phase in the research area, but there are many kinds of clinical data showing the good results. So we can use the PBM and TDCS, RTMS for the developmental issue too, and eventually combine to the neuronal regulation. And the long COVID case, we can use there is no biomarker for the long COVID, but there are many populations around the world suffering the long COVID symptom. So we can recruit those populations. We can start the photobiomodulation or TDCS and eventually combine the neurofeedback, because the long COVID is also another kind of neuroinflammatory disease. So we can take advantage of the photobiomodulation as a neuroimmune function activation function. So it is a kind of good use case for the iSync technology, and there are a lot of stress and trauma population. So we can we now have the stress profile report in our HRV quick report. Using the HRV quick report, we can predict the possible burnout population. We can recruit that population, and we can start the PBM for relaxing their brain. And finally, we can combine to the alpha theta neurofeedback or meditation, some kind of vagus activation, combine this kind of neuromodulation and neuroregulation. We can help many people in stress and trauma population. In the TBI and stroke is another neuroinflammatory disease, acute or sometimes acute disease. So using sometime in acute phase, we can start the this kind of photobiomodulation and TDCS intervention. There are actually photobiomodulation studies start from the acute phase stroke rehabilitation. There are strong, many kind of evidence, efficacy, and after the stroke rehabilitation in acute phase, and there are many studies coming from the TBI. In the TBI, also there are some kind of neuroinflammation. There are many efficacy in the literature using the PBM for treating the TBI. So TBI and stroke is another good area we can help. There are many. I know one friend who had a stroke, and he combined this photobiomodulation and TDCS after his stroke. He paralyzed his right side of the body after 2 months of the PBM and TDCS. 2 months of TDCS in his left brain and whole brain photobiomodulation. After two 2 months, he recovered perfectly, and now he shows better brain performance before the stroke. So it is also very promising neuromodulation technology in these issues. So finally, we can combine neural regulation, and I mean neurofeedback, to transform their brain activity into the healthier area. So this is a brief overview of our product. After the quick recording, the data wirelessly transmitted to the tablet, and then after the recording, the data goes through the Wi-Fi, arrived at the cloud, and the data denoised by AI and compared with health normative database and many kind of biomarker analysis done by after the analysis, norm comparison, and finally we can get the quick summary report, EEG, HRV, MCI, and another machine learning biomarker analysis report usually in 10 minutes after the recording. Our device specification is there are very detailed specification, but most promising feature of this device technology, it gives maintain the 10-20 location during the recording, and it gives the suitable pressure, contact pressure in each electrode location to give us the quality recording. And there is that's why we can get the quality recording and exact source localization, because it maintains the 10-20 location with many kind of head shape, and it can give the suitable contact pressure to maintain the good quality signal. That's the 10-20 automatic positioning patent. Expanding the headset, all basically our headset maintain the 10-20 positioning. This is the async brain process. AI denoising is this kind of standardized pipeline process, and after the denoising, we can have this kind of sensor and source level feature and norm comparison. This is the peer-reviewed publication of our normative database. And after the recording, you can find this kind of underactive area. For example, the psychiatrist can use the stimulant rather than the calming medication, for example. And using this information, we can stimulate this area using the photobiomodulation, sometimes TDCS, sometimes RTMS. And this is until now, many psychiatrists did not use this kind of QEEG mapping, but adoption of our quick and integrated reporting structure solution, they can find the QEEG, and then QEEG guided intervention is possible. This is our MCI classifier. You can see under 60% is the normal area, over 60% is the MCI and dementia area. This is the clinical study result. The accuracy is around 91%. This is the peer review publication of this machine learning biomarker. We use this kind of conventional machine learning process. We collect the homogeneous disease group data And in each data, we extract the pictures. And in each EEG, we extract around 30,000 EEG picture from sensor and source level and connectivity data. And we can, using that kind of picture, extracted picture, we can go through this kind of machine learning process. Finally, we find the best model for prediction, MCI, for example, or early depression, the brain age for child and adolescent. This is the brain age model for child and adolescent. This is the final regression curve for using our machine learning biomarker for brain age in each brain lobe, frontal, temporal, and parietal, and occipital. And this is the ADHD case, having the frontal slowing and also mu rhythm. In the theta beta ratio, this area is very high, so highest deviation from comparison to the normative database. And we can also see the deviation in the source level with G-score mapping. And we can find the brain age in this specific child. In the frontal area, the brain age is quite smaller than his biological age. So we can target this area for activating the frontal function through photobiomodulation and TDCS or TMS, and also combined with neurofeedback. This is MCI classifier recently revalidated using our iSync wave technology. We distribute our iSync wave in 3 different university hospitals and 2 different universities. These 3 different university hospitals collect the MCI or dementia population and record their EEG using iSync wave. And this is the control data. The 2 universities recruit the healthy population. And finally, we have the around 78 accuracy, close to the accuracy is a little below the 90% original clinical study, but still, basically we used dry EEG recording and automatic analysis. In the original clinical study, we used wet recording and also manual expert denoising. But in this MCI classifier study, we used the iSync wave and the automatic analysis. It is a validation study. The neurologist can satisfy around 80% accuracy to only detect in their routine clinical practice. This is the this is a recent validation study result. Before starting this study, we hosted a training session for iSync wave recording. All the participants coming from 5 different, 3 university hospitals, 2 university researchers. They didn't know EEG before the training, but after 1 day training, they can record good quality recording. They can get a knowledge which is the good quality EEG, which is the bad quality EEG. They can start the clinical EEG validation study after 1 day workshop, and now they have this kind of 80%, around 80% accuracy. This is the validation result. So we want to spread this kind of quick recording and early prediction of MCI population using our technology. This is the reason our depression screening study. Depression screening we can detect the early the possible depression developing population around 90%. So we can now integrate this age-based depression model in our service platform. This is recently published in Frontiers in Psychiatry. I think the HIV recording simultaneously with 19-channel EEG recording, the heart tachogram, HIV tachogram extracted automatically, and we can compare the normative database, and we can find this kind of heart rate and HRV profile compared with the normative database. This shows the sympathovagal balance, and we can find the people are having the good HRV, excellent autonomic nervous function. HRV is quite large G-score, and the heart rate is quite lower than average. This is excellent. This population continuously stressed, then go this direction, overload. HRV is lowered and heart rate is higher. High area, this is overload. Finally, the weak area. This is the kind of HRV two-dimensional chart to find the excellent overload and finally weak area. And this is the HRV tachogram distribution, and this is the 5 different HRV stress general adaptive syndrome model, the homeostasis, from the homeostasis to the burnout stage. We can predict the HIV-based stress population. Some people has this area we have to intervene as early as possible to, if once develop the burnout, it takes more time and more energy and more money to going back to the normal homeostatic area. But if you start the intervention in alarm on the resistance state, it will be more efficient for helping people and caring the people. There are also this kind of HIV-based emotional analysis. The photobiomodulation is very safe and efficient healing mechanism, and Harvard University has many kind of efficacy study, especially in the traumatic brain injury. I will explain a little bit more at the product demo. Now I'd like to share my tablet screen here. Can you see the tablet screen?
Yes.
And in the tablet screen, usually we can start EEG measurement. For example, just click the EEG measurement, and for example, we can register the people like this. Like this. For example, me. Simply, I can select like this. We can. This is the registration process, and then we can find the approval of the agreement, and then we can start the recording. And usually, the connect the device. This is the device. Just clicking the. Can you see? Just clicking the power button, then the Bluetooth can be connected like this. And after the connection, you can start the impedance measurement before the recording. Usually, the impedance, I usually recommend this is the dry ease recording, but I usually recommend clean this forehead area. This is the ground electrode, and the left ear, this is the reference electrode. And prepping the ground and reference is very important for getting the quality recording. So sometimes I usually want to recommend try this kind of U-prep. U-prep remove the dry skin cell to make the impedance better. So using the dry U-prep for making the contact electrically good contact, and then we can wear a headset like this, the anchoring the forehead.
No, excuse me, Dave. We can't see what you're doing. We've still got one of your slides up.
Pardon?
We can't see what you're actually doing with the headset. You've got
yeah. You cannot see my screen?
We can see a screen that says preparing for measurement.
You've got the tablet still on, and we can't see you, Dave.
I can see him on the video. Don't you have the...
Yeah, I can see you on the video too. Yeah.
Terry, you might need to change your view settings up the top of Zoom, view options, and then click side-by-side mode.
It looks good, Dave.
Okay. Yeah. Okay. After wearing a headset like this, gently pushing all the electrode like this, and then just clicking the start for checking the impedance. Then the color yellow or green means the good impedance, and red means the bad impedance. Sometimes we can use the vibration to make to taking away of hair in each contact area, and sometimes we can take away of the hair using the tail comb, and then we can in this case I don't have the good connection in some area, but we can check the impedance once more like this, and now more stabilized. Then checking the signal quality is very important. So and then we can start the signal check. In the signal check, this is my Age signal. The T3 has some muscle activity. And also at the same time, we can measure the PPG like this. And EEG signal and PPG signal is quite good, I think. So we can start the recording. Before start the recording, we can select the recording time, and now we start. For example, I'd like to start 2 minutes.
Measuring starts in 5 seconds. Stay awake while measuring.
This is the I can start the eyes closed recording. This is the test recording, so I can open, eyes open and eyes closed. you can find the change of the eyes closed and eyes open recording like this. You don't have much time in this presentation. So usually I recommend 5 minutes recording because 5 minutes give us the good HIV report. And so, 2 minutes eyes closed and 2 minutes eyes open combined 5 minute recording using the eyes closed recording and eyes open recording, and we can find the difference between eyes closed and eyes open. And using the eyes closed recording, we can get many kind of machine learning biomarker. Eyes closed, the alpha generate. And I catching, grinding the teeth, there's a lot of noise. Okay, eyes open. This is the EEG, dry EEG device. And many people can get this kind of quality device easily once after training the half-day training course, and then they can easily adopt the EEG in their clinical practice. Even the home user can use.
Open your eyes. Measuring starts in 5 seconds. Keep your gaze fixed on a certain downward direction in front.
Even the home user can measure their EEG at home after their neuromodulation at home. Before and after, they can monitor their progress during the home neurotherapy training supervised by their remote experts. It takes a lot of time, so I'd like to pause and the recording session, and we can after the recording we can get the for example we can get the results, for example like this. We can display the results, for example like this. We can change the montage like this. This is common average montage. And also we can get the result like this. This is the red and blue area is underactive and overactive pattern. We can compare the hypothesis of the patient's symptom with the QEEG finding to design the QEEG-guided intervention. And we can also find the HRV summary like this. And in this case, the quite balanced HRV. And we can find this kind of HRV analysis. In this case, quite good. And the MCI summary, in this case, MCI is also very good in this case. But usually, this I'd like to briefly, after the recording, we can find this kind of analysis usually in 5 or 10 minutes. And also, you can find the same result here. I can show you. This is the portal site. A moment. For example, you can find the same result here after the recording like this. After the recording, you can find the same result here. For example, easy summary like this. You can find the same result and very comprehensive result too. And you can also find the normative comparison report. In this case, like this. And you can also find the AMCA screening report, AMCA report, and HRV report. In the same data, you can also find the result. You can also find the result in the portal site. So using this portal site, you can connect the remote patient and you can connect the expert expert using this portal site. You can connect and combine the EEG and HRV result to design the personalized protocol. And I don't have much time, so I'd like to briefly show the one example case. For the autistic child, this is the raw data, a very noisy data. And in this noise data, after the cleaning, automatic cleaning, we can find the clean data here. And we can see many kinds of spike here, repeatedly shown in the clean data. And this is the component. You can see this component time series. The 19-channel EEG gives us the 19-channel component time series. This is the component time series. The component is very special. Sorry about that. In the component time series, this is the component time series for this patient. And you can find in the original time series, it is very difficult to find the epileptic spike, for example. But in the component time series, you can find the epileptic spike like this. It is the component analysis. So you can target where is the exact source location of the sensor level activation using the component. For example, there are 19 speakers in the room chatting at the same time. In the mics around that 19 population, all the mics recorded the mixture of the 19 different people's voice, but using the component analysis, the component analysis separate all the different speakers' voice in from the specific location. So using the adaptive mixer component analysis, we can identify which area, from which area abnormal EEG activation oscillate. In this case, in the component number 3 is the most strong epileptic spike position, and so we can find the component number 3 where it comes from. For example, this component number 3 coming from this MNI coordinate. This is the x-axis, this is the y-axis, g-axis is the vertical axis from the horizontal plane. So we can find the exact MNI information. We can target that area for the intervention, for example. The first component is also has very slow activation like this. Very slow frequency activation is around 3 and 4 Hertz. And you can see the topo map here, and you can find usually the first component is very important in terms of the component analysis, because the 19 components usually order in the order of the power. The first component coming from this area, in this case, insula area. Insula generated slow wave is not normal healthy one. You can find this amplitude is the blue is more greater value than red. So this area, in this case, right side frontal side of area is the deviant source of the component. You can find the abnormal component, and you can locate the TMS intervention. For example, if you apply the TMS, you can localize the TMS coil focus point using this MNI coordinate, or you can using this TDCS intervention for activation. For example, another activation targeted this area, or you can target that area for the photobiomodulation. Usually, the underactive pattern in the photobiomodulation, you can use 40 Hertz and 45 Hertz. For the high overactive area, you can use the photobiomodulation for 10 Hertz or for enhancing the more relaxed state. Or for the TDCS, you can target that area for sedating the response using the cathodal stimulation, for example. The component information is very important because it is separate the source location, source activity in terms of this kind of source level activation. It is the time is time is so limited. It is.
Thank you, Dave. No, don't worry about it. I just want to thank you very much. That was wonderful, insightful, and it's amazing to see where you're at. And it's really incredible to think where you're going to be in the next couple of years. By the way, that's very good look. It's very quite fashionable.
Yes.
And I just want to see, there is one question in the chat by Michelle, who asked if you can actually do a couple of EEGs, put them together, combine the data, and evaluate pre and post treatment outcomes.
Yes. We have a strong group statistics in the iSyncBrain platform, and you can make the group of people, for example, homogeneous group, can add it in the one group folder, and you can find the pre characteristic of that group, and you can find the post treated profile after the intervention. You can easily compare the pre and post using the specific group data. it is very well, very simply implemented in our iSync Brains platform. You can take advantage of, even you can take advantage of normative population. If you don't have normative population, you can recruit the normative population from the iSync Brain platform. You can compare and you can find the specific disease group biomarker easily. So data is important. So all the subsequent analysis is well implemented in our strong software platform.
Thank you. Terry's got a question. Go, Terry.
Yeah, yes, thanks, Dave. That was wonderful. That's an amazing piece of apparatus. My question, can you control the LEDs individually?
Yes, basically 19 channel has LED in each electrode. So you can select the specific network on specific position, and you can select the specific frequency. For example, long COVID population, you can select 15 Hertz to activate. And for the neurofeedback population, you can also select the 15 Hertz to preparation of their neurofeedback training. And during the training, many people get very tired during the neurofeedback training. Then intermittently, you can start the photobiomodulation, 15 Hertz, then they can get energy, microglia, mitochondria get the energy in the neural cell, neural tissues, and also microglia is very strong for the neurodegenerative disease, Alzheimer, Parkinson, and the stroke, TBI is very beneficial to all the neuroinflammation. Long COVID is also possible.
Lovely. And is this available in Australia?
Yes, there is an Australian distributor, so you can get the demo of the device from the distributor. Yes.
Lovely, thank you.
I've got a question, Dave. Could you please?
Yes.
I'll bring the. My concern is that we can add to cover temporal areas and cerebellum.
We cannot locate the cerebellum source activity because our source level atlas we use did not include the cerebellum yet. So we cannot locate the cerebellum activation in the source level at the moment.
What about temporal areas, like T5, T6? Does it cover them well? Or?
Yes, T5, T6 we can locate in those areas, but cerebellum we cannot localize cerebellum activity.
Okay, thanks. Thank you, Dave.
There's probably just one more question, Dave, in relation to how much is the equipment?
I cannot answer that question because I'm not the person in charge of that information. So maybe our distributor will answer that question.
Thank you so much.